The future of cancer research is ongoing trials, and it's listening to the basic science as well.
I never thought we would be doing targeted therapy, because you know what your tumor is consisted of if it has certain markers or certain characteristics. I never knew that we would ever be able to have drugs that are aimed at those markers.
We have gone from a situation where the curability of breast cancer has improved by at least 25% since I started practice in 1977. And our death rates have plummeted for all cancers.
In the 1960s, we would have had to remove your breast, and you don't have to do that anymore. Or in the 1980s, we would say that you needed to do radiation to the lymph nodes, but you don't need to do that anymore, right? So there might be a day where I might say, we used to always remove these surgically, but we don't have to do that anymore.
And with the advent of immunotherapy, which has really only been in the forefront over the last 3 to 5 years, we've seen long-term survivors of metastatic breast cancer, long-term survivors of metastatic melanoma, and long-term survivors for almost all malignancies, including metastatic prostate cancer.
Clinical trials are imperative to medicine moving forward and us taking better care of patients with more effective treatment and less side effects as we move through life.
Cancer is a tough enemy to deal with, right? You can't see it, can't feel it, can't taste it, can't smell it. But it's there, and when you have a win, when you have a clinical trial with a great outcome and we can start making improvements in our patients' lives because of a new way of treating the cancer, that's a win, and that's something that we all celebrate.
It's very possible that before I die, hopefully in another 25 or 30 years from now, that perhaps we will have a cure for cancer.
I would love to be put out of a job and not have to treat people for cancer.